Do you have ear pain? Do you suffer from chronic reoccurring ear infections? Then this video is for you. Not only am I going to share what you can do naturally, but what you should not do. I'm Dr. Karin Drummond, owner of Drummond Chiropractic. And as always, before you follow any advice from any video, check with your healthcare provider to make sure it's appropriate for your specific condition. And hopefully that's one of us here at Drummond Chiropractic. And if you know anyone that this can be helpful to, please share with them. So the number one thing you should not do is use Q-tips. If you use Q-tips, it can actually impact the wax further deeper into your ear canal, and that can make it more difficult to remove that ear wax. So do not use Q-tips. Another thing I'm not a fan of is ear candling. Both personally and professionally, I have not seen much success with ear candling. Instead, try ear oil. With ear oil, you want to make sure it's warm enough to melt the wax, but not so hot that it actually burns the lining of your ear canal. If it's too cold, it can actually cause dizziness. How to warm the ear oil is you take the bottle of the ear oil and place it in a bowl of nice warm water, just like you do when you're warming a baby bottle. To test the ear oil to make sure it's warm enough, put a drop of it on the inside of your wrist to make sure it's nice and warm, but not too hot. And then do another test drop in the ear itself. If it's not too hot and not too cold, then go ahead and apply a whole dropper full of ear oil in and lay on your side for a couple of minutes to make sure it has time to melt the ear wax. After a couple of minutes, get a cotton ball or a rag, place it on your ear so when you stand back up, as the ear oil drips out along with the wax, it won't get all over the place. And then do the other side. You don't want to do just one ear, because if you have an ear infection in one ear, chances are there's some bacteria on the other side. So you always want to make sure you do both sides. Another thing you should do if you have an ear infection or ear pain is gargle with salt water. The reason being is the ear has an ear canal called the Eustachian tube that drips down into the throat. So you want to make sure your throat is clear and clean so it doesn't just reinfect the inner ear. Another thing you should do is do a sinus rinse. I personally like using the neti pot, and the reason this is because the nasal cavities also drain into the back of the throat, where it also has that Eustachian tube where any kind of bacterial infection can kind of intermingle between the sinuses, the throat, the ears. So you want to make sure all of that is super clean. Another thing you could do is do a cranial release. I have a whole nother video on the benefits of cranial release and how to perform it. Another thing you could do is support yourself nutritionally or with supplements, again under the guidance of a healthcare provider. But often these things include L-lysine, Echinacea, garlic, turmeric, that's also an anti-inflammatory. Local honey is great because it's also good for allergies. And again, if you're fighting off allergies, can you see how that's going to impair your ability to fight off bugs? So make sure that you're avoiding allergens as well. As with most things, if you're eating well, moving well, like with a cranial release, another thing is sleeping well, making sure you're getting enough sleep, because sleep is when we heal. So I hope these basic tips have been helpful, and if they have, please let us know by clicking the like button. If you have any questions, you know we love hearing from you, please post them below. Again, if you know anyone that can help, please share with them, and until next time, stay well.